Recovering from a heart attack or heart surgery can be a major challenge, both physically and emotionally.
But experts say the majority of patients are missing out on an important tool in that recovery, cardiac rehab.
Cardiac rehab is probably one of the most promising, but unfortunately underutilized resources in our medical system.
Only about 20% of eligible patients participate in cardiac rehab, a structured exercise program that helps patients safely return to physical activity. Dr. Nicole Bave, a cardiologist at University of Michigan Health, says that number is even lower for women and minorities. Less than 8% of eligible Black patients take part.
And unfortunately, we know that minorities are particularly under-referred for cardiac rehab.
Patients who complete cardiac rehab have a 47% lower risk of death and a 31% lower risk of heart attack. They're also less likely to be readmitted to the hospital.
First, and probably most importantly, we know that it improves longevity after a heart attack. Patients actually live longer with cardiac rehab. Second, we know that it can improve their symptoms. It can improve their ability to exert themselves. They might have less chest pain associated with blockages in the heart arteries, and it can also improve their quality of life.
And there are emotional benefits too.
They really enjoy that sense of community that they get from meeting other patients with similar diagnoses, and being able to exercise with confidence and without fear is a major benefit.
Studies find the greatest predictor of participation is the strength of the doctor's recommendation.
I think that we can do better both in terms of referring patients and also strongly encouraging patients to participate by letting them know just how important it is.
In addition to racial disparities, income is also a key factor. People who make more than $75,000 a year are twice as likely to participate as those who make below, say, $15,000 a year. Wait times and lack of transportation, also big barriers to increasing participation.